Hello everyone. Today we will discuss about a topic of fever. So you might think why we are discussing such a simple topic. Nowadays, young generation doctors, even for a case of fever of some 4 to 5 days or 1 week duration, we are forgetting somewhere to assess minimum basic things, and we will just order investigations and we will randomly will not be able to decide at least to some extent what type of fever it is, like that. So it is our duty to assess any case of fever presenting for 4 to 5 days or 1 week duration. And we know that once we start reading about fever, we'll see in the textbooks that patterns of fever, types of fever, intermittent, remittent, all those things. We know that these things are boring, but keeping such things apart, there are some other important things to be assessed in fever. So we'll discuss those things first. Whenever we get a case of fever, we have to look for some associated features first. For example, we'll deal one by one now. For example, same, an individual has presented with, suppose, 5 days history of fever, that's all. Then we have to assess some associated features. For example, is there any headache or retroorbital pain? Retroorbital pain. This simple question we have to ask them. If it is significant, then we'll consider the next thing. Then in examination, we have to look for pulse rate. Suppose there is bradycardia or tachycardia, consider it as significant. Then just palpate the abdomen. Suppose we get right hypochondriac region tenderness, and in some cases if there is features of bilateral pleural effusion. So these are the things we are assessing in the examination. And is there any rash? So these things we have assessed in the examination, and then we will take the help of investigations. For example, initially anyways we will get CBC done, so we will get platelet count as low. So with this one, what we are thinking now, obviously it might be a dengue fever. So if we have assessed this much, we will be eligible to order dengue profile, that is NS1 antigen and antibodies, IgM, IgG antibodies we can order, and other related investigations. So minimum assessment should be like this. Then for example, the second example is same case of fever of 5 days duration, and in associated features there are some rashes over the body. Then there was diarrhea for initial 2 days, then now it is constipation in the history, and in examination we are able to feel slight hepatosplenomegaly. Then there is again pulse is showing bradycardia, for example, bradycardia, and we are taking the help of investigations, that is basic. In that we got neutropenia, for example, neutropenia. So with this history, we will be able to make out that it might be probably typhoid fever. So we are suspecting typhoid, that is enteric fever now. So then what investigation we will be eligible to send or order? That is Widal test. Widal test which will confirm the diagnosis. So this is second scenario. Coming to the next one, again individual presenting with 5 days history of fever, and in this case there is significant chills, rigors, and fever is in a pattern that some days in between the individual is feeling off fever, that is fever, off fever for 1 day. Next day, in that particular day, he or she would have thought that the individual is fine, but the next day immediately again they got fever. So chills and rigors are associated in this case, and on examination we will be able to make out icterus, for example, and hepatosplenomegaly, in some cases anemia or pallor too. So this is the presentation. In investigation we got that there is low hemoglobin and low platelets count, and suppose if we have ordered for LFT, bilirubin is raised bilirubin. So with this presentation we will be thinking of malaria. So now we will order for peripheral smear to look for malarial parasite. So this is another example. Suppose the individual is female, presenting with fever. Again, there is some kind of chills associated and lower abdominal pain, burning, micturition history. And on examination also, no such findings except mild tenderness in lower part of the abdomen. We have ordered for investigations and total counts are little bit high. So obviously in this case we will be thinking of urinary tract infection. Then we will order for urine microscopy to look for pus cells and urine culture sensitivity. So this will confirm the diagnosis like that. And in some cases, the next scenario will be fever with, we'll clean it off first. So in this case, again fever with rash, with puffiness of face, and some breathing difficulty. These are the associated features, for example. And in examination, there is feature of pleural effusion and some degree of renal injury, for example. And in investigation, we got that there is low platelet count. So in this case, we will initially, with this low platelet count and fever with rash, we might think of dengue. Along with that, there is difficulty in breathing. So we'll get dengue profile done. So first thing is we are considering dengue. And this will go negative and the renal injury is worsening. And if the individual is developing hyponatremia, for example. So all in such cases, and there is worsening of respiratory symptoms like that. So in such atypical cases, we have to think of rickettsial fever. We can get Weil-Felix test done. So this is about rickettsial fever. One more example will be directly the individual is presenting with fever of 5 days duration and jaundice. Like they will have abdominal pain, vomiting, and some degree of renal injury. Renal injury is there with significant musculoskeletal pain. And in examination, in this case, we were able to locate lymphadenopathy, lymph node enlargements. This was the only finding, for example. In investigation, again, we got low platelet count, raised bilirubin, and enzymes normal liver enzymes, and AKI also. So this is the presentation. In this case, we have to think of leptospira. So leptospira infection, we can send for IgM, IgG antibodies to confirm the diagnosis. So usually there will be significant musculoskeletal problem and hepatic and some degree of renal injury will be there associated with fever, which we call also as Weil's disease. And in some cases, the individual will present with fever and there will be associated myalgia of minor degree and joints pain, fatigue. No positive findings on examination, for example. And in investigation wise also, there might be little bit elevation of the total count with neutrophil or lymphocyte predominant picture in the CBC. So in such cases, we can think of viral fever. Sometimes there will be associated lymph node enlargement, but majority of the times we will not get it. We can consider that fever as because of viral infections. So these things should be considered before just randomly sending for investigation and treating with some antibiotics, antivirals randomly. All those who are practicing medicine, general practitioners, even postgraduates who have joined newly or who are there in the practice, please follow this initial assessment for even case of fever. Don't neglect it and don't just rely on the investigations randomly. Do read more about fever. Thank you so much.